If you have high blood pressure, what I'm about to show you might be the simplest tool you'll ever learn, and it's something you've had since the day you were born. Your breath, not a pill, not a supplement, not another doctor's visit, just breathing. And in the next 2 minutes, I'm going to prove it to you, live, because we're going to lower your blood pressure together while you're watching this video, right now. I'm Dr. Claire Whitmore. I've spent over 20 years treating patients with hypertension. I've prescribed medications, I've adjusted doses, I've watched people go from 1 pill to 2 to 3 to 4. And here's the truth most doctors never say out loud. Medication controls numbers. Breathing controls your nervous system. And your nervous system controls your blood pressure. That's the root. Every second of every day, your blood pressure is being controlled by 2 systems. Your sympathetic system, fight or flight, and your parasympathetic system, rest and relax. When you're stressed, when you rush, when you breathe fast and shallow, your body releases adrenaline. Your vessels constrict. Your heart beats faster. Pressure rises instantly. But when you slow your breath, the opposite happens. Your vagus nerve activates. Your vessels dilate. Your heart rate slows. And pressure drops. Not later, immediately. Clinical studies published in American Heart Association journals show slow breathing can reduce systolic pressure by 10 to 20 points. That's the same effect as adding another medication, except this is free, and you're in complete control. So let's not talk anymore. Let's test it. If you have a blood pressure monitor nearby, pause and check your pressure now. Write it down, because in 2 minutes, we'll compare. Ready? We start with the most powerful beginner technique. Technique number 1, 4, 7, 8, breathing. This method was popularized by Andrew Weil, and I've personally watched it calm patients faster than many medications. Here's why it works. The long exhale is the secret. Long exhale, parasympathetic activation, which means relaxed vessels, lower heart rate, lower pressure. So we're going to do this together. Sit up straight, relax your shoulders, put one hand on your belly. When you inhale, your belly should rise, not your chest. Ready? First, empty your lungs completely. Slow breath out through your mouth. Good. Now follow my counting. Inhale through your nose for 4. 1, 2, 3, 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Now slow exhale through your mouth for 8. 1, 2, 3, 4, 5, 6, 7, 8. Perfect. Again. Inhale. 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale. 2, 3, 4, 5, 6, 7, 8. 2 more cycles. Continue counting. Good. Now pause. Notice your shoulders, looser, jaw softer, heart slower. This is your nervous system shifting gears from stress to repair, from fight to healing. If you measured your pressure before, check it again now. Most people see 5 to 10 points lower after just 2 minutes. Some drop even more. I had a 72-year-old patient whose pressure would spike to 165 during stress. After 2 minutes of this breathing, every time. No extra medication, just breath. And here's the key. Not once. Daily, morning, midday. If technique number 1 felt calming, this next one is even simpler. No breath holds, no complicated counting, just smooth, steady rhythm. And this is the technique I personally teach most of my older patients first, because it's almost impossible to do wrong. Technique number 2, resonant breathing, 5-5 rhythm. This technique is sometimes called coherent breathing or resonance breathing, and it's been studied in multiple hypertension trials. Here's what researchers discovered. There's a specific breathing speed where your heart, lungs, and blood vessels synchronize, like instruments tuning to the same frequency. That number is 6 breaths per minute, not 12, not 18. 6. That means 5 seconds in, 5 seconds out. When you breathe at this speed, your heart rate variability improves, your vagus nerve activates, stress hormones drop, blood vessels widen, and blood pressure naturally falls. This isn't relaxation theory. It's physiology. It's measurable. I've watched this happen in clinic countless times. Let me tell you about Margaret. She was 76, perfect blood pressure at home, but every time she walked into a doctor's office, 170 over 100, white coat syndrome, her body would panic the moment she saw a medical setting. Doctors kept increasing medications. Nothing changed. So I taught her this exact technique. 5 minutes in the waiting room before every appointment. 5 minutes. Her next visit? 135/82. No medication change, just breathing. The nurse thought the machine was broken. That's how powerful this is. And the best part? Nobody even knows you're doing it. You can do this. Driving, watching TV, lying in bed, sitting at work, waiting in line. Completely invisible. Let's practice together right now. Guided practice. Sit comfortably. Back straight but relaxed. One hand on your belly. We're breathing through the nose only. No force, no big dramatic breaths. Just slow and smooth. Ready? Inhale. 2, 3, 4, 5. Exhale. 2, 3, 4, 5. Good. Again. Inhale. 2, 3, 4, 5. Exhale. 2, 3, 4, 5. Keep going with me. In. 2, 3, 4, 5 out. 2, 3, 4, 5. Nice and quiet. Imagine you're trying not to fog a mirror. Smooth. Effortless. 2 more. In. 2, 3, 4, 5 out. 2, 3, 4, 5. Last one. In. 2, 3, 4, 5 out. 2, 3, 4, 5. Stop. Don't move yet. Notice how your body feels. Heavier, warmer, calmer. That's not placebo. That's your parasympathetic nervous system taking control. When that system dominates, your arteries relax automatically. You don't have to try to lower pressure. It happens by itself. If you checked your pressure earlier, check again now. Many people see another drop. Sometimes 8, 10, even 15 points after 5 minutes. And here's something important most people don't realize. This technique doesn't just lower pressure temporarily. It retrains your baseline. When you practice daily for 2 to 3 weeks, your nervous system stops living in fight or flight. Your default state becomes calm, which means your average daily blood pressure drops. Not just spikes, your baseline. That's how people reduce medications, not with one session, but with consistency. How to use technique number 2. Here's exactly what I recommend. Morning, 5 minutes. Evening, 5 to 10 minutes. Total time, 10 to 15 minutes per day. That's less time than scrolling your phone. But the cardiovascular benefit is enormous. If you only choose one breathing exercise from this video, make it this one, because it's sustainable. And sustainable habits change health. But sometimes you don't have 5 minutes. Sometimes your pressure spikes fast. Stress hits, heart starts racing, you feel flushed, maybe anxious, maybe even scared. You need something that works immediately, in under a minute. That's where technique number 3 comes in, and this one is my emergency tool. Technique number 3, alternate nostril breathing, your emergency reset. Now let's talk about the one I keep for emergencies. Not daily training, not maintenance. But those moments when your pressure suddenly jumps. Maybe you get upsetting news. Maybe you feel anxious. Maybe your heart starts pounding. Maybe you check your monitor and see a number that scares you. That surge is not fluid. It's not salt. It's not cholesterol. It's your nervous system, adrenaline, fight or flight. Your vessels clamp down instantly. Pressure rises fast. And in those moments, you need something stronger than slow breathing alone. You need a hard reset. This technique has been used for hundreds of years in traditional breathing practices. Today, we understand exactly why it works. Because alternating nostrils directly balances the 2 halves of your autonomic nervous system. Left side calms, right side stimulates. When you alternate, you rebalance both. Heart rate slows, stress hormones drop, vessels relax, and pressure falls quickly. I've seen this work in under 3 minutes. Let me tell you about Robert. He was 68. At night, his pressure sometimes jumped to 180/100. He would panic, which made it worse. More fear, higher pressure, a vicious cycle. I taught him this technique. 3 minutes at bedside whenever he felt a spike. Within minutes, his numbers would settle down into a safer range. No extra pills, no late-night hospital visits, just controlled breathing. Let's practice together. Slowly, step by step. Guided practice. Sit comfortably. Spine tall. Shoulders relaxed. Raise your right hand. Your thumb will close your right nostril. Your ring finger will close your left. Gentle pressure only, not forceful. Ready? Close your right nostril. Breathe in through the left. 2, 3, 4. Now close the left. Open the right. Breathe out through the right. 2, 3, 4. Good. Now inhale through the right. 2, 3, 4. Close right. Open left. Exhale through the left. 2, 3, 4. That's 1 full cycle. Let's do 3 more. Slow, quiet, smooth. In left, out right. In right, out left. Again. In left, out right. In right, out left. Last one. In left, out right, in right, out left, and relax your hand. Breathe normally. Notice your face, your shoulders, your chest. Most people feel an immediate drop in tension, almost like someone turned down the volume inside your body. That's exactly what's happening. Your nervous system just shifted gears. If you ever feel a sudden spike, this is your rescue tool. 5 minutes. Anywhere. Anytime. How to use all three together. Your daily plan. Here's how I recommend combining everything you learned today. Simple, structured, easy to follow. Morning. 5 minutes of resonant breathing sets a calm baseline for the day. Midday. 2 minutes of 4 to 7, 8 breathing. Quick reset for stress. Evening 5 to 10 minutes. Resonant breathing again. Helps your body unwind before sleep. And anytime you feel a spike. Alternate nostril breathing. 3 to 5 minutes until calm. Total daily time, about 12 to 15 minutes. That's it. No equipment, no prescriptions, no side effects, just your breath. Something you've had your entire life. Why this works so well after 50. As we get older, something important happens. Our nervous system becomes more sensitive to stress. We react faster, we recover slower. So even small stressors can push blood pressure higher than before. Breathing retrains that response. It teaches your body. You're safe. Relax. Open the vessels. And when that becomes your new normal, your baseline pressure drops, not just spikes. Your everyday numbers improve. That's the key. Not chasing emergencies, changing your default state. A gentle reminder. These techniques work alongside your medical care, not instead of it. If you take medication, continue as prescribed. But many people find that after weeks of consistent practice, their readings improve enough to talk with their doctor about adjustments. That's the goal. Support your body naturally. Let it do what it already knows how to do. Closing. So remember this, your body isn't broken, it isn't failing. Often, it's just stuck in stress mode. And your breath is the switch that turns that mode off. Free. Always available. With you every second. Tonight, before bed, try 5 minutes. Just 5. See how you feel. Check your numbers. Let the results speak for themselves. And if this helped you today, share it with someone you care about. Because sometimes the simplest tools are the ones nobody ever teaches us. Take care of yourself. Breathe slow. Stay steady.